I saw my mother, I saw my stepmother, I saw my mom going through so much with my dad, going through so much, and it was so overwhelming, and my heart hurt seeing her cry and seeing her. What am I gonna do? How am I gonna do this? I have no help. And we stepped in, and I remembered, and you guys stepped in. Hospice Care stepped in and did such an amazing job. It was just unbelievable. Aquí estamos, ladies and gentlemen. Estamos aquí at the Brownsville Event Center with Concord Hospice Care. Just waiting for some people to go live here on my broadcast. Estamos aquí platicando con pues el mero mero de Concord, Mr. Julian. Thank you so much, Julian, for having me here. Y también aquí hablando con toda la gente aquí from the health fair, ¿verdad? It's called what is it, the 9th annual? It's a bit long. The 9th annual Health and Wellness Expo for Winter Texans / community. Ahí va. Anyways, we're going to go live here. Here we go, then. Oh, here it is. It is called the 9th annual Senior / Winter Texan and Community Health and Wellness Expo 2025. Así es.
But it's welcome, and everybody's welcome to come by and join us as well.
All right. Yeah. So we're here. We're going to be answering some questions. I'm going to be talking about my experience with Concord Hospice Care. Julia, thank you once again for having me, man. Thank you.
No, thank you, Lucky. We love to have you, and we're really appreciative of you being here. My name is Julian Silva. I'm the Administrator for Concord Hospice Care. And we're here to talk about a lot of the misconceptions about hospice, and we're just grateful to you for your community service, to be willing to talk about your experience that you had with hospice. There's a lot of people out there in the community that don't understand what hospice really can be or should be, and sometimes they feel that it's giving up on a loved one, and it's not that whatsoever, but we'll dig into that a little bit more. And thank you again for having us.
No, al contrario. It's an honor for me to be here with you guys at this event. I had my experience with Concord Hospice Care, and we're here to inform everybody, like Julian was saying. Estamos aquí para informar a toda nuestra raza que Hospice Care no es asetencia de un final, sino es una ayuda. Es una ayuda para todos los que están pasando por este caos, ¿no? Muchas de las veces cuando nos encontramos con nuestros seres queridos que ya están en los últimos días, no sabemos qué hacer, ¿verdad? Y eso así entra Concord Hospice Care para ayudarle a las familias con este tiempo difícil, ¿no? I know that I appreciate you guys so much for what you guys did for my family as well. Y estamos aquí para informarlos, más que nada, educar a la gente de qué se trata, what it is about, and what hospice care provides, what Concord is going to provide for your family, and a lot of the misconceptions that a lot of family have, I think is about, what I heard something about that they had to sign over their property and they had to do this and that. Explain to us, Julie. Eso no es real, ¿no?
No es verdad para nada. Al contrario, muchas veces la gente que ha trabajado, ¿verdad? Y trabaja, les quitan el Medicare withholding. It's called FICA. So, esto es un derecho que mucha de la gente ya ha pagado en el sistema. Y por aquellos que no, como quiera se les ofrece este servicio. Y es un servicio gratis que todos lo podrán tener. Y si los llaman, nosotros pudiéramos darles las explicaciones, ir a tomar el tiempo para hablar con ellos. But it's all right. Everybody's paid into the FICA, withholdings, and so forth. So the big misconception, eso pasa mucho aquí en el Valle. And you're right, lo que piensan que si les van a dar el beneficio, le van a quitar la casa a mamá o mi abuelito, y no es así.
They get scared, guys. He's saying that, a lot of the times, families think, well, if we sign up with hospice, we sign up with Concord, they're going to take mom's house away. They're going to take dad's house away because they're in this state in their lives. And it's not true. The best thing for you to do is call Concord Hospice Care and ask these questions that you have. Si están pasando por un tiempo difícil así, hay muchas cosas que entran en nuestra mente, hay muchas cosas y mucha gente que nos da mala información. Y en estos momentos son vulnerables. These are vulnerable moments that we pass. And I speak from experience, Julian. You know, we're vulnerable at that moment. Oh yeah, we don't know what's going on. We don't know who to listen to, who's right, who's wrong, who's giving us the right advice. And luckily, you know, when I went through this with my father passed away this past December the 2nd. Luckily, I had a good friend. I have a good friend that's in hospice care. And I got to speak to Julian. Julian advised me. We went in there, and my experience with Concord was excellent. I have to say that nos quitó mucha frustración. It took it away from us. Even though, you know, my father passed away, pero se fue en paz, se fue tranquilo, se fue con ese tratamiento que Concord nos dio, se fue tranquilo. Y eso es lo más importante. I think that's the most important thing that Concord provides is tranquility within the family. And it's not, you know, it's not unprofessional. It's very professional, very caring, very, very loving approach that you guys have, Julian. And I think it comes from,
Thank you. Thanks.
I think it comes from, you know, your upbringing. Your mom is a wonderful lady, is a wonderful person. Instilled a lot of good values in you guys. And that's what I got from Concord.
Thank you very much, Lucky, for that. And just to clarify that, para clarificar las cosas, no se queden con dudas, háblalos. Porque si tienes a tu papá, tu abuelito, your loved one that's going through this emotional time right now that they need services, get clarification, háblalos. Vamos y les damos las explicaciones que podremos hacer por ellos. Sin ningún miedo, sin ninguna duda que le vamos a quitar la casa o cualquier cosa que tengan ellos.
Yeah. Oye, tienes el número. You guys have the number so I could show it here on the write it down for me so I could show it for my fans. Y también for your podcast. You know, I'm so glad that you're having me for the first time here in your podcast. I know you're starting up a podcast. ¿Cómo se llama el podcast? So you don't have a name yet for it.
We don't have a name, but we felt that there is a need for it, Lucky, because there's so many misconceptions, misunderstanding about hospice. So ponte in, which you already been, in their position. So what if your dad needs that hospital bed? Any type of D&E equipment. Y están batallando when they're not supposed to. That's what.
Well, those are the things, right? These are the things that hospice provides. Explícales tantito, Julian. For those of them who don't know, I know my father, you guys provided the hospital bed, a breathing machine, equipment, so.
Everything and anything they could need that you can imagine, Lucky. From the pharmaceuticals, the pain medication que van a necesitar. Y muchas las veces we have a nurse practitioner readily available. Por ejemplo, si ellos se sienten malitos because they're going through whatever diagnosis they have, they don't have to go to the doctor's office. You just call us and our nurse practitioner will make an appointment to go visit you at home. So that you don't have to be in the waiting room, you know, que te van a ver. We bring you the medication to your house. If you're taking también any type of food supplies or whatever you need.
Yeah.
Wheelchairs, walkers. So it just depends on your diagnosis.
You know, and the readiness that they have is something that I noticed so much with my father. The quickness that it took. It didn't take you very long for you guys to send someone and pick up my father and go to the house and make sure everything was ready inside the room. Todo preparado, todo bien, entró la cama. My father was on his way in the ambulance. Y ya pa cuando llegó, by the time he got home, everything was ready in the room. And it's a big weight off your shoulders, if I could say that. You know, going through something like that weighs very heavy on one's shoulders, on the whole family. And having this extra help, it means a lot to the family, and it takes a lot of stress out of what we're going through. Again, guys, the number to call if you're in the RGV, it's 956-532-7983. Y también tienen oficinas en San Antonio, también que les pueden ayudar, 210-238-3697. We got a fax machine. The regional office is based out of Ed Couch. and the address is 7981 Mile 17 North in Edcouch, Texas. I'm going to put the flyer up here really quick so you guys can see it. It's going to be backwards, but take a screenshot. Take a screenshot of it. Si quieren, guys, and infórmense, edúquense, call in and ask questions. Right now we're at the health fair in Brownsville Event Center. Y si volteo la cámara, ven que está lleno aquí de gente que viene a informarse de diferentes cosas que necesitamos. Pues ya cuando ya estamos más grandes de edad, ya necesitamos muchas diferentes cosas. Y aquí están muchas compañías, ¿verdad? Pero ahorita estamos con Concord Hospice Care, aquí en vivo y en directo con el dueño, Mr. Julian Silva, informando a toda la gente de qué se requiere, ¿verdad? Oh, all right. So what is it that we need or they need in order to be able to qualify for hospice care?
I'm going to introduce, this is Cindy Ureste, and she's going to go ahead and give all the explanations. Les van a explicar cómo podrán hablarlos y les podemos explicar los beneficios.
Hi, how are you, Ghosties? Good morning. Good to see you again. What is it that the client needs to have in order for them to receive this help? Let's try to explain it in layman's terms para ayudar a nuestra gente. So the insurance.
So the insurances that we accept are Medicare, VA, and Medicaid.
Ándale.
To qualify, you have to have a diagnosis that is uncurable. We're regulated by the government, so we have to meet those regulations. So that's why we have to do the verification. We do that in the office. And then we need a physician's order, and we need medical records, your clinicals, to look at your history, your background, in order to identify that diagnosis.
Así es, lo que necesitan es prueba de que lo que está pasando tu ser querido es terminal, y también el aseguro con beneficios que puedan aceptar este tipo de ayuda. Un diagnosis quiere decir que el doctor te tiene que dar prueba que lo que tiene lo que tiene el cliente es terminal, que ya no le podemos ayudar, los doctores ya no pueden hacer nada para ellos. So, ellos necesitan prueba de eso para que ellos puedan entrar a ayudar a la familia, ¿no? I just said what you said, but it's Spanish.
I appreciate it.
You're welcome.
I am bilingual, but I don't know it fluently.
Yeah.
So basically, to your followers, thank you for being here this morning. But we are very passionate about what we do. It's helping the community here in the Rio Grande Valley. We service the entire RGV from Cameron County, from Brownsville, Port Isabel, up north to Raymondville, the surrounding counties, the rural area, all the way to Rio Grande City. So we're here available. Our nurses are on call 24/7, and we just want to be able to help the community when they are at that very critical time with their loved one and they don't know what to do. If you just want information, just call the office, or you can call me at 210-607-0344. And you can speak to me directly, and I can answer any questions for you.
And you know, the key point, I think one of the key points that you said right now, and for everybody to listen to this, you service rural areas that, colonias. Si tú piensas que no se van a poder meter allá a tu rancho, donde está tu abuelita, o tu tío, o tu hermano, o tu papá. No, ¿cómo van a llegar aquí al rancho? No. Ellos they're going to service you wherever you are, in whatever colonia you're at, any rural area, desde San Antonio hasta el Valle y todo el mágico Valle, they're servicing. So, sin miedo, hay que informarse, hay que llamar al número, como estaba diciendo. They service all areas and all the Rio Grande Valley. It's very important. I have to say that I'm super for hospice care. I'm super pro Concord Hospice Care because I actually lived it. And you guys helped me so much, and there's not an amount of money that I could repay you with. It's just a gratitude from the bottom of my heart que me hicieron sentir tan bonito. Más que nada, hicieron sentir a mi papá confortable. en sus últimos días, y también a su esposa, que, I saw my mother, I saw my stepmother, I saw my mom going through so much with my dad, going through so much, and it was so overwhelming, and my heart hurt seeing her cry and seeing her, what am I going to do? How am I going to do this? I have no help. And we stepped in, and I remembered, and you guys stepped in, hospice care stepped in and did such an amazing job. It was just unbelievable. They had a nurse there, would pop in, help my stepmom with my dad. Any and all equipment that was needed was provided. Even the medicine, you didn't have to go, like Julian said, you didn't have to go and wait in line. You didn't have to go and talk to anybody. Ya tenías todo ahí. Hospital bed, wheelchair, bedpans,
Right.
medicine, colchas, in-house nurse. It's just so amazing.
It is. It's a beautiful benefit, and I always tell that to my clients and my patients and my families. It's covered 100% by Medicare. It's under the Part A, under Medicare. This is your benefit. When you turn 65 and you have Medicare, hospice is under the Part A.
Fíjate, wow.
And it's yours. We've paid into it all these years. So it's available to you when the time comes that you need that benefit. It's just wonderful. And what Lucky Joe was talking about earlier is the disciplines. We've got a registered nurse, a CNA for bathing and changing. We have a chaplain for spiritual support. We have a social worker for psychosocial support. The entire team is always available to you. Of course, you can use the disciplines as you need them. The equipment is covered. Your supplies are covered. It all falls under that hospice umbrella. So please call us if you have any need information, or you have a loved one or a neighbor or a relative or someone you know that is battling a uncurable illness, a terminal illness, and see if we can help them. We would love to help.
Cindy, a lot of people don't know, mucha gente no sabe que el Medicare que ya tienen, ahí tiene una opción
Sí.
que ofrece hospice care. Ahí tienen la opción ustedes que no saben. Y educándose, informándose, se van a dar cuenta que ahí está para el uso de ustedes. Ahí está en Medicare, ahí tienen la opción de hospice care. Así es que hablen al número, infórmense bien. Cindy, there's not much more I could say about how appreciative I am with Concord, and we have to inform the people. We have to inform the people of all the benefits that Concord provides. Ahorita estamos en el Brownsville Event Center at the 9th annual. Take it away.
Community and Wellness Expo. There's a lot of people coming in. There's vendors. There's all types of vendors here today. We have our sister company, Good Shepherd, PHC, Provider Services, and then
Good Shepherd is okay. So Good Shepherd is what is Good Shepherd?
Provider. It's Provider Services.
Do you want to speak about Good Shepherd? Would you like to talk about Good Shepherd?
Here comes Erica. Erica will talk a little bit about Good Shepherd, which is our Concord's sister company. And I'm going to hand the mic to her. Thank you so much. Thank you, followers, and call us if you have any questions.
Thank you guys for staying on my live. 24,000 viewers, digo. We're going to talk to Good Shepherd. Good Shepherd, again, is a sister company of Concord Hospice Care. Now, you guys, hello, ¿cómo está?
Hi,
Nice to meet you. Your name is?
my name is Erica.
Erica. All right, Erica. Now, tell us a little bit about Good Shepherd.
So my name is Erica. I'm here
Right there.
I'm here for Good Shepherd PHC. I'm here with my coworkers, Chardine and Linda. If you need provider services at your home, you can call us at 956-262-7445 for more information. Also, you can follow us on Facebook for any updates or events on our agency. Our services are for all ages that qualify as well.
So it's a provider service. I know my sister used to be a provider. Big shout out to my sister, Rosie. What does a provider do? What do they do?
So they help with daily activities at home, like cooking, cleaning, if they need assistance.
Okay, cool. So the provider goes in there and helps them, with their daily activities from a certain time to a certain time.
Yes.
They cook breakfast, they cook lunch, they help them up, they sit them up, sit them down.
Yes.
Clean a little bit, limpian la casa, los providers, o tienen que, o no tienen que. Do they have to?
If the task is on there, yes.
Oh, okay.
Yes.
If the task is on there, then well, that's good. Again, Good Shepherd is a sister de Concord, and son puros servicios que uno necesita, uno utiliza a nuestra grande edad. Ya cuando when I know I'm gonna need a provider, or maybe my wife could be my provider. Well, thank you so much for sitting down with us and talking a little bit about the provider services of Good Shepherd. Good Shepherd is also based off of Ed Couch. También, it's actually right there with Concord, they're sisters. So, es una compañía muy linda también. Así es que, para más información, is there a number for Good Shepherd as well?
Yes.
A number for Good Shepherd. If you guys need any provider services, the number to call is...
Our phone number is 956-262-7445.
There you go, guys. Thank you. Thank you so much. Aquí viene Julian una vez más. Una vez más, guys, thank you so much for being on live here with us. I know there's a lot of people that might be at work right now, but right now we're at the Brownsville Event Center at their 9th annual health fair with the senior citizens. Eso.
Yeah.
Well, thank you, Julian.
Yes, sir. Thank you very much, Lucky. As Erica was telling us, Good Shepherd is our sister company. We are valley-wide all the way up to San Antonio, which we call, and the business is called Region 8. The Rio Grande Valley is Region 11. So we have coverage all the way up to San Antonio. We even have coverage all the way to Houston. We have patients in Houston, San Antonio, Uvalde, Dorrigo, Eagle Pass, y todo el valle. So Good Shepherd is our sister company. Y es para aquí, para ofrecerles el servicio to complement us, Lucky.
Así es.
Porque en veces si tienes hospice care, you also need a provider. Somebody to help you bathing, somebody to help you eat, help you with your medication.
So it's 2-in-1. So it's 2-in-1 también. Here with Concord. Concord not only provides the hospice care, but it also provide a provider también at the same time, because we need that extra help. Muchas las veces, it's all the help we can get. The more the merrier, ¿no? Como quien dice.
Yes, sir. Yes. That's very true. And please, everybody, don't forget that no se queden con las dudas. Aunque, let's say we can't, or they don't want services from us, I hope they do. Pero for whatever, I mean, it's ultimately your choice. We can help you decide and point you in the right direction. Para que no se queden con las dudas, because if your loved one está sufriendo, necesita esa medication, ese equipo, también the chaplain to go pray with you, a social worker to find the other services. No los dejan sufrir.
That was one of my favorite parts. That was one of my favorite parts, Julian, of the experience that I had with Concord. A pastor showed up to pray for my father, and it just, I sensed, I don't know if you guys are strong in faith. I respect everybody's religion. I respect everybody's beliefs, ¿verdad? But my belief is that, when the pastor went in there and prayed for my father, I sensed a tranquility, a peace within the room, and even my father's breathing se calmó tantito, and it was something so beautiful. Again, I can't express how appreciative and thankful I am for Concord Hospice Care to be there in that very stressful moment for my family. Es algo inexplicable. Así es que si están pasando por eso o presienten que van a pasar por eso, if you have a loved one that is sick, and if you just got notified that they're going through this, terminal illness, contact Hospice Care, contact Concord, and again, like Julian said, we'll point you in the right direction. If you guys are not comfortable with what you see here, we'll point you in the right direction. La onda es ayudarnos, ¿no?
Yes, sir. And we are here to help our community valley-wide, all the way up to San Antonio. And we are from the Delta area, but we are statewide. So we're happy to be from the Delta area, but we have many patients in San Antonio, Eagle Pass, Del Rio, Carrizo Springs,
Wow.
Crystal City.
Wow.
We service all that area.
That's awesome. Yo siempre ando por Eagle Pass. I always play at the Kickapoo Lucky Eagle Casino. I go play there a lot. And I had no idea. Now that I know, I'm going to go out there and promote you over there in Eagle Pass, man.
Yes. Yeah, we service all that area. And I can't thank you enough, Lucky, doing this community service, because somebody out there probably has been thinking about it. More than likely tienen su abuelito o abuelita que está malita y necesita ese servicio. And let me kill that myth again. No más porque piensas, no, I don't want to give up on grandma. No es eso. Is you want to get ahead of the game. We plan for like our retirement. We plan que si los pasa algo, ¿a quién le vamos a dejar esto y lo otro? Well, you need to plan for these services también. You know, you have to be ahead of it, and look at it and prepare for it.
You know, I had no idea. I had no idea that I was ever going to need this type of service. I had no idea this type of service even existed, to tell you the truth. And when my stepmom and my mother, when she told me, Lucky, they're telling us that we're going to have some kind of care, or they're going to send him somewhere else.
Yes.
They're going to send him somewhere else that I don't want him to go. I don't want him to go to a nursing home. I don't want him to go here. Nothing bad about nursing homes. Nothing bad. I'm not talking bad about them. It's that everybody provides their own service. But personally, we wanted him home. Now, if you want your loved one home, you need this hospice care. That is what it's for, to have your loved one at home. And when my mother, she said, Lucky, I don't want him to go nowhere else. Do you know of anything, of anyone? And I don't know why. It just clicked. It just, the light bulb, Julian, just turned on. I said, Julian? Julian and I have known each other for a very long time. Back in the day, a little backstory real quick. Back in the day, I used to teach his son, Juliancito, how to play the accordion. Ya no es Juliancito, ahora es Juliancito. So I used, big shout out to Julian the third. Yeah, I used to show him how to play the accordion. Y de ahí nos conocimos. So when I went through that with my father, that light bulb went on when my mother said, Lucky, we need this. We need this. If not, they're going to send them away. If you don't want them to send them away, if you don't want your loved one away from you, and you know they're going through this terminal illness, that's a very good point. That's a very good point that you guys need to look at. You want them home, or they want to be home. Even my father said to my mother, Me quiero ir para la casa.
Yes.
Me quiero ir para la casa, mamá. Yo no quiero que me manden para ningún otro lado. And that's when they called me. That's when I called you. And that's when they stepped in and they did what they did. This amazing job they did. Así es que, guys, call, get in touch with Concord Hospice Care. Prepárense desde ahorita. Prepare yourself, because you are going to need it. And it's there for you. It's there, like she said, like Cindy says, covered. Medicare, it says there, it's under there. There's an option for you guys to get it. A lot of people don't know that.
Yes. Capitalize on it. Aprovechen. Tienen que aprovechar de estos servicios que están dispuestos para todos. I personally went through it through my grandparents. Both of them passed away about 2 years ago. So when you were mentioning that it's at a very emotional part of your life, you know, no estás pensando es, you know, muchas cosas. So there's where we come in. We have the professionals. We have the disciplines. Necesitas to pray, we'll send you a priest, we'll send you a chaplain, whatever faith you might have. The pain medication, the DME equipment, your medical supplies, Lucky. Cualquier cosa, every angle that you can think of, that's what we do.
You know, there was a section, and I don't want to get too grim or too deep into it, but there was a part there in my dad's hospice care where my dad, his mouth would be dry all the time. He'd be dry. And my mom would be like, ay, mijito, I don't know what to do. His mouth is so dry. Le dije, ma, no te mandaron esponjitas con agüita que para que le mojaras la boca. Dice, see, they're here. So my point is this, they provide you with any little thing that you need, that you might be going through. My dad's mouth was a little dry, man, and she didn't know what to do. And then she remembered, oh, they did. Ya usó esas cosas. Todo lo que necesitas tú para el servicio de tu ser querido, ahí va a estar. Concord se va a encargar de eso. And Julian, thank you so much, man. Thank you for having me.
Thank you, Lucky. Thank you so much.
Guys, we're going to be here. I'm going to chill out with my good friends here from Concord Hospice Care. We're here at the Brownsville Event Center for their 9th annual health fair.
There we go. Mira, aquí lo teníamos. Like, Fabio se fue.
Yeah, you had it there. Again, here's Cindy's number. Here's Cindy's card. Take a screenshot of that if you'd like.
Aquí está.
Okay,
And it's free.
It's free admission. We're here and we're free. You can't see it, but it's gonna be called, or it's called, the 9th annual Senior/Winter Texan and Community Health and Wellness Expo 2025. It's free admission. We have so many things out here. We have so many different clinics and so many different agencies here offering their services. Again, a big shout out to everybody that's here today. Thank you so much for showing up. Y también for Concord Hospice Care for having us on their podcast, for having me. And thank you, man. Muchas gracias. There's nothing else.
Muchas gracias, Lucky.
Muchas gracias. Nosotros nos vemos, guys. Thank you. Don't forget to share this video. Share it. Share this stream with somebody you might know that might be going through something like this. Comment on the comments below. If you have somebody, comment their name. And if you want to help them out, inform them of what we're talking about. Again, guys, thank you so much. Have a great day.
Bye-bye, everybody.
Bye-bye. Yeah, what on your podcast? Ahí los vemos, guys. Thank you.
Bye, everybody. Thank you for attending.